Hello everyone, welcome back to the channel. Today we're traveling far into the past to answer a fascinating question. Did people get cancer thousands of years ago? If they did, what caused it, and how did ancient doctors try to treat it? Let's uncover the truth behind one of history's oldest and most mysterious diseases. Many people believe cancer is a modern disease caused only by pollution, processed food, or technology. While modern lifestyles can increase the risk of certain cancers, the truth is much more surprising. Cancer has existed for thousands of years. Scientists have discovered evidence of cancer in ancient Egyptian mummies that are over 3,000 years old. They have also found signs of cancer in ancient skeletons and even in dinosaur fossils that are millions of years old. This tells us that cancer is not new. It has existed for as long as living creatures have existed. Cancer begins when some cells inside the body stop following the normal rules of growth. Instead of growing, working, and dying at the right time, these damaged cells continue dividing uncontrollably. Over time they form a mass called a tumor. Some tumors remain in one place, while others spread to different parts of the body. This spreading is called metastasis, and it makes cancer much more dangerous. So what caused cancer in ancient times? The causes were often different from today, but many were surprisingly similar. People in ancient civilizations lived without factories, cars, or plastic, yet they were still exposed to many natural dangers. Smoke from cooking fires filled homes every day. Families spent hours breathing smoke from burning wood, dried animal dung, or charcoal inside poorly ventilated houses. Long-term exposure to thick smoke could damage the lungs and increase the risk of lung disease, including some forms of cancer. The sun was another major factor. Farmers, builders, soldiers, fishermen, and travelers spent most of their lives outdoors. Without sunscreen or protective clothing, their skin received years of intense sunlight. Continuous exposure to ultraviolet radiation could damage skin cells and eventually lead to skin cancer. Some ancient people were also exposed to naturally occurring poisonous minerals. In certain regions, water and rocks contain substances such as arsenic, which can increase the risk of cancer after many years of exposure. Although they had no idea these minerals were dangerous, people drank the water and used the land for generations. Infections also played an important role. Today scientists know that some viruses and bacteria increase the risk of cancer. These infections existed long before modern medicine. For example, long-lasting infections could cause chronic inflammation, damaging tissues over many years. Ancient people did not understand germs because microscopes had not yet been invented, but infections silently affected their health. Diet was another factor. Although ancient diets were often healthier than many modern diets, food preservation methods sometimes created risks. Meat preserved by heavy salting, smoking, or drying over open fires could contain harmful compounds. Mold growing on stored grains and nuts sometimes produced dangerous toxins that could increase cancer risk if eaten regularly. Genetics also mattered in ancient times, just as it does today. Some people inherited changes in their genes that made them more likely to develop cancer. Even in the healthiest environment, these inherited risks could not always be prevented. When ancient doctors encountered tumors, they usually did not understand what caused them. They explained disease using the beliefs of their culture. In ancient Egypt, illness was sometimes believed to result from blocked channels within the body or from supernatural forces. Egyptian medical texts describe hard lumps in the breast that could not be cured. One famous medical document, known today as the Edwin Smith Papyrus, describes breast tumors and sadly concludes that there was no successful treatment available. The ancient Greeks made important observations. The physician Hippocrates believed the body contained four fluids called humors: blood, phlegm, yellow bile, and black bile. He believed cancer developed when too much black bile collected in one area of the body. Although this theory was incorrect, it influenced medicine for nearly 2,000 years. The word cancer itself comes from the Greek word for crab because some tumors appeared to have veins spreading outward like the legs of a crab. Without modern hospitals, doctors had very limited treatment options. If a tumor was small and located where it could be reached, some surgeons attempted to remove it using sharp bronze or iron instruments. Surgery was extremely painful because anesthesia did not exist. Patients were often given alcohol, herbal mixtures, or strong natural sedatives to dull the pain, but they remained awake during the operation. Stopping bleeding was another major challenge. Ancient surgeons often used heated metal instruments to burn blood vessels closed. This process, called cauterization, reduced bleeding but caused severe pain and increased the risk of infection. Herbal medicine was widely used across civilizations. Doctors prepared mixtures from plants, honey, oils, garlic, onions, willow bark, frankincense, myrrh, and many other natural ingredients. Some herbs help reduce pain or inflammation, while honey was useful because it naturally slowed the growth of some bacteria, helping wounds heal more effectively. However, these remedies could not cure cancer itself. Many patients also turned to spiritual healing. They prayed in temples, made offerings to the gods, wore protective amulets, or sought blessings from priests and healers. Since no effective cure existed, faith often provided comfort even when the disease continued to progress. As centuries passed, doctors slowly improved their understanding through observation. They noticed that some tumors grew slowly while others spread rapidly. They learned that removing a tumor early sometimes helped patients survive longer, although many cancers returned because the remaining cancer cells could not be seen. Life with cancer in ancient times was incredibly difficult. There were no X-rays, CT scans, MRI machines, blood tests, chemotherapy, radiation therapy, or targeted medicines. Doctors relied only on what they could see and feel. By the time many cancers became visible, they were already advanced and difficult to treat. Today, science has transformed cancer care. Researchers now understand that cancer develops because of changes in DNA, the genetic instructions inside our cells. Modern medicine can detect many cancers much earlier, perform safer surgeries, destroy cancer cells with radiation, treat them with chemotherapy, use immunotherapy to help the immune system fight cancer, and develop targeted drugs that attack specific cancer cells while causing less damage to healthy tissue. Early detection through regular medical checkups has saved millions of lives. Looking back at history reminds us how far medicine has come. Ancient doctors worked with limited knowledge but showed remarkable courage and curiosity. Their careful observations laid the foundation for future discoveries. Although they could not defeat cancer, they never stopped trying to understand it. Thank you for watching. If you enjoyed learning about the history of cancer and ancient medicine, don't forget to like the video, subscribe to the channel, and turn on notifications for more fascinating journeys into the mysteries of history. See you in the next video.